heck is the triangle of death, and what is she talking about? I'm a dermatologist, and this is a reference to the danger triangle of the face. Basically, if you were to draw a triangle from the bridge of the nose to the two corners of your mouth, if you get an infection in this area, you are at risk of some pretty gnarly outcomes. Essentially, this location has a direct highway connection to the inside of your skull and to your brain. It connects to something called the cavernous sinus. You have some very important nerves. There's even a vascular connection directly to your brain, and it's also around a lot of important things like your optic chiasm and your pituitary gland. So it is a tight space, and anything messing it up can get really serious really quickly. One of the most dreaded complications from an infection in the danger triangle is a cavernous sinus thrombosis. Either from traveling of the bacteria or clotting of blood flow, you can clog up the area in this cavernous sinus. And back in the day, this was basically a death sentence. Like, the mortality rate from cavernous sinus thrombosis was 80 to 100%. Now, when it's found early and when we use modern science and antibiotics, the mortality rate's more like 8 to 13%, but there can still be very severe, detrimental, persistent, long-term side effects, even if you're treated. Like, in 50% of patients, there is still some remaining nerve deficit. Like, they can't move their eyes correctly, they have persistent pain. So you want to avoid this condition as much as possible. And one of the easiest ways you can do it is to not pop a pimple in your face, especially in this area. Because when you pop a pimple, you risk causing an infection. Your hands are dirty, you're pushing that bacteria that's on your skin deeper in, it can mess things up. Thankfully, this woman did all right, but it is just a great PSA for you to never pick a pimple and never wait. Get medical care if you're worried about having an infection in this area. That's it. What do you guys think?